Hello, my name is Georgette Nkwo and I'm Nurse Case Manager with Systemedic. Today we're going to talk about the coronavirus, understanding and managing recovery. We're going to talk about etiology, transmission, manifestation, inpatient treatments, discharge, and community management. COVID-19 is the diagnosis for the illness caused by the coronavirus. This virus is determined to be in the family of the SARS virus. The original etiology of the virus is still unknown, but evidence suggests that the virus has been around since late December 2019. The virus is transmitted from human to human. Researchers determined it was spread through droplets. The virus can live on multiple surfaces for up to 4 hours, and research also suggests that the virus was airborne for a short period of time. The incubation period for the coronavirus is 1 to 14 days, followed by fever, dry cough, body aches, and dyspnea, which is difficulty breathing. The symptoms mimic the flu, but the distinctive symptom that differentiates them is the dry cough. The symptoms are mild to severe. Some people do not report the cardinal symptoms. The inflammatory process of the disease triggers comorbidities, which then signal that testing is needed. To expand on this further, when the virus enters the body, it creates an inflammatory process so great that the body is unable to control it. And because this creates an inflammatory response, the blood cells are stripped of their oxygen carrying capacity, which makes it difficult for the people to breathe. It affects mostly men, people with pre-existing conditions, and the immunocompromised. At this point, there are people who do not present with the cardinal signs of the virus because their comorbidities have been exacerbated and they're exhibiting different symptoms until they get tested for the coronavirus. Inpatient treatment includes oxygen via nasal cannula, ventilators with patients in a prone position. At the very beginning of this pandemic, the majority of the patients were placed on ventilators, but as we have learned more about the process of the disease, ventilators are being used only as necessary. Combination antiviral medications and antibiotics. Over the last 3 weeks, remdesivir has been touted as one of the antivirals that have shown fewer days of infection in COVID-19 patients. Oral Diamox has been used. Part of it is because some of the doctors realized that due to the nature of the disease process, stripping the blood cells of oxygen carrying capacity, Diamox will help maintain as much oxygen carrying capacity left in the body. This is a drug that is usually used in high altitude climbers or in altitude sickness in general. Nebulizers are being used as well. Occupational, speech, and physical therapy are used in the hospitals. Upon discharge, the majority of the population with the coronavirus is set up with their primary care physician under the diagnosis acute respiratory distress syndrome. Education on social distancing, wearing masks, and sanitizing is being provided. A lot of the patients are being discharged with nebulizers. There are limited resources in the community to monitor recovery at this point because we're still trying to determine what needs to be paid attention to. Community management. People who report onset of symptoms or those who tested positive for the coronavirus are required to quarantine in their homes for 14 days. Since the beginning of this pandemic, there has been a lot of confusion surrounding the word quarantine. Some people take it to mean just stay home and do whatever you can, and other people take it as just staying away from a general population. Quarantine actually is put in place to separate you from the general public if you have come in contact with anyone with the coronavirus. This puts you in a place to protect yourself and family members and the general community at large. Telehealth or telemedicine is at the forefront of treatment in the community. Physicians are able to evaluate symptoms and prescribe medications which mostly consist of nebulizer treatments and antibiotics. Antibody testing is being done to determine who has been exposed, but the true purpose at this point in time during the pandemic is to gather as much information as possible to determine how it's going to be used and understood in the future. Targeted treatment is being provided where there are clusters of cases, such as spikes in the rural areas or prisons. Managing the injured worker during treatment in the community. Systemedic provides community treatment based on evidence-based practices. We obtain a thorough history and create a timeline and treatment from the first report of symptoms to present. We determine if testing was done and what was prescribed. We assess, educate, and implement an in-home plan to address symptoms such as muscle weakness, fluids, and diets. If the injured worker was not admitted, quarantine for 14 days will be strongly encouraged with collaboration with the community resources to facilitate the quarantine. At this point, facilitating quarantine has involved clinics using drones to deliver medications or using telemedicine to monitor patients or assisting with delivery of medications and other necessities that the injured workers need. Education will be provided on an ongoing basis on the coronavirus and how to prevent the spread and assist in creating plans with involved family members on how to protect themselves. There are some households with multiple people living in them, more than 10 sometimes. This is going to be very, very vital in understanding how the disease is transmitted from person to person and how to protect themselves, what to expect, and what to report if anyone has symptoms or a general sense of malaise. Education on medication management will be provided on an ongoing basis as well. Managing the injured worker after recovery in the community. If the injured worker was admitted to the ICU, a multidisciplinary approach will be used to monitor and treat muscle weakness, loss of function, dependence on others for care, anxiety and depression with a PTSD component, depending on how severe or how long they spent in the ICU. This is particularly important because with the ICU component involved in any disease process, but in this situation with the coronavirus, which is not a normal exacerbation or acute problem that lands you there. This is a disease process which the prognosis is surrounded with death, even though there are recoveries. All these need to be taken care of because most of the patients do not get up and move around as often as they should, are isolated from their family members because a lot of the healthcare facilities limit visitors to come visit these people. So there is also nutrition loss and retraining of people with activities of daily living. These patients may need physical therapy and occupational therapy. They may need counseling and or psychiatric medication management. The family members of these patients benefit highly from using resources in the community in regards to the loss of function, how to manage the injured workers or family members at home. The most affected organs are the heart and the lungs. The lungs tend to be fibrosed and will need close monitoring to determine how the coronavirus will affect the injured worker long term. The lungs and the heart are the worst affected organs because when the blood cells are stripped of their oxygen carrying capacity because of the inflammatory process, there are certain molecules that enable clotting that get released into the blood system. So through views of lung x-rays, there have been multiple cases with very small blood clots. There have also been people who have presented to the hospital with malaise, pain in an extremity, and had to be tested for coronavirus. Usually those people already present with a blood clot somewhere. If the injured worker was not admitted to the ICU, the same multidisciplinary approach after discharge applies. The types of resources in the community will depend on the severity of the disease process. At this time in the community, there are a lot of groups trying to understand what patients need after quarantine, and after discharge into the community. Antibody testing is being conducted at this point, and a lot of plasma from the people who have recovered from the coronavirus is being used to transfuse other patients. Results of these vary. There are some people with much improvement, and there's some people who there's barely any improvement. But we will learn as we go and provide support, encouragement, and collaboration with our community partners.